VividMind, a major milestone in the fight against dementia.
We screen for dementia using voice as biomarker. We use a short recording of the sound ah onto your smartphone. We use patented sound processing technology to analyze your voice and make an incredibly precise spectrum of it. Then we put some classifiers onto this recording and we compare it to a set of about 600 samples that we have. And on the basis of this, we can classify whether you're in a risk category or whether you're okay. That's essentially a screening diagnostics of dementia.
At VividMind, we are blazing new trails in the fight against dementia, a disease that affects millions of people around the world every year, and unfortunately, their numbers are expected to grow. Our goal is not only to change the way dementia is diagnosed, but above all to improve the quality of life of the affected people and their loved ones. Our technology, using voice as biomarker, opens up new possibilities in detection of the early onset of dementia. Thanks to cooperation with leading academic centers, our patented approach is based on solid scientific foundations. At VividMind, we are pioneering a revolution in the early detection of dementia through the analysis of the patient's voice. Our advanced artificial intelligence systems, together with the technology of sound objects, can pick up the first symptoms of cognitive impairment from just a 6-second voice sample, paving the way for faster implementation of effective treatment. The effectiveness of our technology is demonstrated by the Memeo Health application, which analyzes user speech, identifying subtle changes in tone, pace, and expression, which may indicate potential symptoms of dementia. Users see how their results compare versus those of a broader population, which allows them to better understand the context of the test and act accordingly. Being able to observe the test's detailed parameters helps users understand which elements have been included in the screening diagnosis. Memeo Health also offers interactive cognitive exercises to help keep one mentally alert, while the account linking feature allows users to monitor the health of not just themselves, but also their loved ones. Join us in our pursuit at VividMind. Together we can change the future of dementia capture and care.
And now for the ELSA project. We've set ourselves 5 goals for the project. The first one was to increase the size of our data set to enable us to achieve accuracy levels of over 82%. We think we've exceeded this goal substantially. Our data set has grew to over 600 data points. We don't know yet what effect on accuracy this is going to have. The work on algorithms is still ongoing, but we're confident that we're going to exceed our accuracy goals. We have also performed substantial cleanup of the data, and right now we feel we have the largest and highest quality data set in the industry. The second goal was to improve our product to achieve TRL level 9. And we also think we have accomplished that with our B2C version of the product, which we're going to be launching in the fall. On the B2B front, we have launched proof of concept pilots with live clients in the hearing aids industry in Denmark and in the business of patient recruitment for clinical trials with a large specialized clinic in Warsaw, Poland. So the progress on the commercial front has been substantial, and we think it warrants TRL level 8, if not 9. The third objective was to build a team that would allow us to pursue the certification of our product as medical device. We've partially accomplished this objective. We've gathered a team of experts, and right now we know who we're going to be working with on this front, although we have not struck contractual arrangements with those experts, and we do not have designed a clinical protocol yet. The fourth goal was to assure the compliance of our algorithms with the ELSA standards of ethics and quality. We think we've made substantial progress on this front. We've done a very thorough self-assessment and gap bridging, but also we have hired, thanks to the ELSA funding, an external consultancy that is conducting a thorough review of our processes and documentation. We think we've made substantial progress, in particular in the area of the safety of our client data and security of our algorithms. The last objective was fundraising. We set ourselves a goal of 500,000 euro to be raised to cover our expenses for certification processes. We've partly accomplished this objective, but we have also in the process gained our first professional investor in the form of the Danish VC Sound Invest that agreed to be our lead investor and put in 100,000 euro investment into VividMind. We have also secured an investment of $65,000 from business angels. Currently, with the lead investor, Sound Invest, we are very confident that before the end of the year, we're going to complete the 500,000 round that we set ourselves as a goal. All in all, we're very satisfied with the results of the ELSA project. The results really placed us in a very different league from the standpoint of where we place competitively. It put a new impetus behind us becoming the leader of the space of early diagnosis of dementia with the help of voice as biomarker. Thank you, ELSA.
VividMind, a major milestone in the fight against dementia.